Are you going to the bathroom like this?
Oh!
Or more like this? Hi, I'm Dr. Chan. Today I'm going to talk about the enlarged prostate. We'll go over symptoms, diagnosis, and treatment. I'm going to show you how you can improve your urinary flow. So today's agenda will include talking a little bit about what is benign prostatic hypertrophy, how it is diagnosed, and what are the treatment options. And one of the things that I want to focus on today is talk about one of the newer treatment options that maybe you haven't heard of before, called UroLift. So I'll show you a little bit of the technique and a video of what the procedure looks like at the very end of our talk. So let me go over an overview of the prostate. What is the prostate exactly? This is a walnut-sized gland at the base of the male bladder. It surrounds the urethra like a donut so that the urine passes through the center of it. And it produces fluid that transports sperm during ejaculation. What happens to the anatomy of the prostate over time is that it starts growing to its normal size during men's teenage years, and then around age 50, it starts to grow again. Some other prostate conditions that can mimic some of the symptoms of benign prostatic hypertrophy include prostatitis, which is swelling, inflammation of the prostate, sometimes caused by infection, sometimes not. Prostate cancer. This is a very common cancer among men, and it's typically a very slow-growing cancer. And then finally, enlarged prostate. It's an enlargement of the prostate gland. So each condition affects the prostate differently, and having one doesn't mean that you can't have the other. So somebody with prostate cancer can also have enlarged prostate. And then somebody who has prostatitis can also have an enlarged prostate as well. So this is a very, very common diagnosis to have in men. And then looking at these graphs, you see that at age 50, about 40% of men have BPH. By age 60, that increases to 70%. And then by age 80, almost 90% of men have BPH. So what is BPH? It's known as benign prostatic hyperplasia, and that's the term for an enlarged prostate. It's a non-cancerous enlargement of the prostate gland. BPH is not an indication or a predictor of cancer. Just because you have an enlarged prostate doesn't mean that you have prostate cancer. The test that we usually use to follow prostate cancer, PSA, rises with both BPH and prostate cancer. So PSA can't tell you whether you have an enlarged prostate or whether you have prostate cancer. So when we compare a normal versus an enlarged prostate, what happens is as the prostate gets bigger, pressure kind of gets put onto the urethra so that the opening that the urine can go through gets smaller and smaller. And that's what causes urinary problems. In general, the size of the prostate does not correlate to the severity of symptoms. This is kind of something interesting because a lot of men think that if they have a small prostate, that they may not have any symptoms of voiding issues at all. But that's just not true. You can have a big prostate and have no problems. And then you can have a small prostate and have lots of voiding problems. So what happens if BPH is not treated? This picture here shows the anatomy of a normal looking bladder. See how it sits right on top of the prostate, and the urethra goes right through the center of the prostate. What ends up happening with BPH is that the urine flow becomes obstructed, and it gets a lot harder for the bladder muscle to get the urine out, so it becomes a lot stronger and hypertrophied. Ultimately, not treating the enlarged prostate can lead to bladder deterioration. So this is a nice picture when we take a look with something called a cystoscope, which is a small camera that we pass up through the penis, up into the urethra, and we're able to see exactly what is going on with the prostate. The pictures on the left here is what a normal prostate looks like. The one in the middle is enlarged prostate, and then the one on the very end is a severely enlarged prostate that's restricting urine flow. And you can see the two lobes of the prostate kind of falling in into the center of that screen there. And you can kind of imagine how that would affect urine flow. So some of the symptoms of BPH include frequent urination, multiple trips to the bathroom at night, the sudden urge to urinate, difficult or painful urination, weak or slow urine flow, incomplete elimination of urine, stopping and starting of flow. So a lot of guys who have BPH experience a reduction in their quality of life. Some of the things they might avoid in their life is travel, some of their leisure activities like maybe playing golf, using the bathroom stalls instead of urinals because they have to sit. And then one of the most bothersome ones is just a disruption of sleep patterns. Having to get up so much at night makes it hard to get a good night's sleep. So for nearly half of the men in the US with BPH, their symptoms are bad enough that it interrupts their lifestyle and causes them to seek treatment. The physician, what do we do to diagnose an enlarged prostate? We do a medical history, a physical exam with a bladder scan to see just how much urine is left after you void. Also a digital rectal exam to check the size of the prostate and just make sure there's nothing concerning on it for like cancer. We also have you fill out an AUA symptom score and then really try to get an idea of how much of a bother is it really to you. Other studies that we might do are uroflow, which is where you urinate into this funnel and it measures how fast your stream is. Pressure flow studies, which is part of urodynamics studies where we put a small probe in your rectum and up your urethra and measure just what the bladder pressures are when you urinate. A transrectal ultrasound. This gives us a much more accurate idea of just how big the prostate is compared to the digital rectal exam. And then finally cystoscopy, which is a small camera that goes up your urethra to take a look at the anatomy of the prostate. This is often done in the office. The way we try to kind of quantify symptoms is by something called the International Prostate Symptom Score. It's the same elements as the AUA symptom score, but it has this additional question of how is the quality of life on a scale of 0 to 6. So something between 0 and 7 is what we would consider mild, 8 to 19 is moderate, and then 20 to 35 is severe. So if you haven't taken a moment to just kind of see where you fall on this scale, go ahead and take a moment right now and fill out this symptom score worksheet and tally it up and see what your IPSS score is. So we'll go through the treatment options now. And we'll approach it from the least invasive therapies to the most invasive therapies. What's important to kind of mention is that different treatments are appropriate for different patients. For instance, if somebody who has more severe symptoms may benefit from more invasive treatments, whereas somebody with less severe symptoms may want less invasive treatments like watchful waiting or medications. Let me talk a little bit about watchful waiting. This is exactly like it sounds, just kind of watching and observing the symptoms and not really doing anything active. So the advantage of it is that you don't undergo any surgery, you're not taking any drugs, and there's no side effects because you're not doing anything. The disadvantage is that your symptoms may not improve. And the big disadvantage is that symptoms may worsen over time. Next, let's talk about medications and herbal remedies. Some of the medications include drugs such as Flomax, Avodart, Duodart, and Cialis. And then also some herbal remedies such as like saw palmetto. So first, talking about medications, the advantages of it are that there's no surgery and it may be actually effective enough to treat the symptoms. The disadvantage is that it's something that you're going to probably have to take for the rest of your life. Some of the potential side effects of this are lowered sex drive, erection problems, ejaculation problems, dizziness, lack of energy. And although most of these drugs are generic at this time, sometimes they may have high out-of-pocket cost. Over time, as the prostate continues to grow, it may stop working. As far as herbal remedies go, the advantage is that there's no surgery, there's no drugs that you're taking, and such, there's no side effects. The disadvantage is that you may not actually have any improvement by taking this stuff. Most of the clinical trials have shown no benefit to taking this. The risk is that your symptoms will worsen because you're taking something that hasn't been shown to be effective. And there's potential downstream issues if your bladder worsens, such as bladder stones, bladder health, and worst case, your kidney function may deteriorate if you're retaining a lot of urine. Future treatments may be less effective. So one of the newer treatment options that's come onto the market within the past 7 years or so is something called the prostatic urethral lift system. I want to spend a little bit of time focusing on the advantages and disadvantages of this, and then I'll show you a quick video on what's involved with this procedure. The advantage is that sometimes it can be done as an in-office procedure or a procedure where patients just get minimal sedation. It preserves sexual function, so you don't have any problems with erections or ejaculation. It's rapid, durable relief, typically return to normal within 5 to 9 days, and typically no catheter is needed following the procedure. It's been shown to last for several years. There's good data. Since it's only been on the market for about 6 or so years where they have clinical data, that's as far as long as they can reliably claim. So some of the disadvantages are that there is some discomfort involved, there's potential for some blood in the urine following the procedure, and there's increased urgency after the procedure, but usually that goes away. So how the prostatic urethral lift works is that the delivery device is placed through the urethra to assist the enlarged prostate. Implants are placed through a needle that comes out of the delivery device to hold the enlarged prostate and tissue out of the way, and then the delivery device is removed, leaving a more open urethra. I think a good analogy to this is it's like putting those curtain holders around your curtains to pull them out of the way. This doesn't destroy any tissue, which makes the recovery a little bit faster than the traditional methods that I'll talk about in the next few minutes. There's also heat and steam-based therapies. This is something like TUMT, which is microwave therapy, TUNA, which is radio frequency, and then the most recent one of these type of therapies is called rezum. The advantage is these can be done in the office or with patients under minimal sedation. Oral sedative is used. It's paid by most insurance, and there's fewer side effects than the traditional transurethral resection of the prostate. The disadvantage is that a catheter may need to be left in place after the treatment because it may take up to 4 to 6 weeks until you actually start seeing symptom relief. And there is potential for sexual dysfunction How this works is this is a picture of the steam-based therapy where it's using hot steam to treat the prostate tissue, and then over time the prostate tissue kind of shrinks. And then finally, I'm going to talk about major surgery. This has been around for decades. It's called the transurethral resection of the prostate. You may have heard it described as like the roto-rooter. There's different forms of it, such as the green light, which uses a laser to vaporize the prostate tissue, but the general idea is the same. You're removing tissue. The advantage is that it maximizes flow and symptom relief. It removes prostate tissue, it's durable, and there's like a low retreatment rate. This is what I would consider is the gold standard, just because it's been done for so many decades, and there's a good amount of data showing that it's effective. Now, there are disadvantages to this. It is a hospital procedure with general or regional anesthesia. Usually after a transurethral resection of prostate, patients stay overnight for something called continuous bladder irrigation. Now, the green light laser shows a little bit less bleeding, and some patients are able to go home the same day. Catheter remains in place for about 1 to 5 days to help with the bleeding. There's 6 weeks of limited restricted activity with no heavy lifting. Now, some of the side effects are that 10% of men have erectile problems, 40 to 65% have something called retrograde ejaculation, where the semen shoots backwards into the bladder whenever a man ejaculates. And then 3% risk of urinary incontinence, and then 7% risk of strictures, which is scar tissue that forms in the area of resection. So how the TURP and laser-based therapies work is such. It goes in through the urethra, and we have something like a loop that scoops out the tissue. What to do next? Pay attention to your symptoms before your appointment. Each solution has different risk, benefits, and cost. We want to find kind of the right solution for you. So definitely fill out that AUA symptom score to kind of see where you fall on the spectrum. Are you mild? Are you moderate? Are you severe? And then just know that as urologists, we're here to improve the quality of life so that you can get back to playing golf or traveling more, so that you don't have to be limited by your symptoms. And if you've got any questions, please be sure to just ask them down in the comment section below. Otherwise, be sure to subscribe to my channel so that you can be updated whenever we put out more content. Thanks for watching.